Right hand comes to the right at the center of the pelvis. Front heel bisects the back arch. Now, we're here to strengthen the left buttocks and outer hips. So first, sink and feel what gravity does when you just let go, okay? Then do the opposite. Pull your feet toward each other, lift your hips up. Now, the hard part is tucking the tail in this position, okay? So you're gonna try to push down through your left heel and scoop your left bum underneath. It's gonna create a rounded back position, okay? Pressing down through the left heel and keeping that rounded back position should start to tire out your left buttock muscles. That's what we're going for. The idea is you're pulling your feet toward each other, scooping your pelvis, and pressing down through the left heel. Now, that one refinement for those of you that are a little more advanced, you've been practicing with me for a longer time, is to lift the front of the foot up and rotate the toes out slightly, even the shin out slightly, and drag the outer foot back. That's going to target the outer left hamstring called biceps femoris, which is an external rotator of the knee joint. That should help us out if we can engage this muscle. Will help us out in our lotus posture. I'm going to step the right foot out to the side into dragonfly here. Okay, pick the toes up, turn the toes out. You know, your right hip could be up on bolster or blanket if this is too intense, like so you can be up here, you know, which may or may not be more accessible. And then of course, you know, the further you go this way, the more intense it is. The further you go this way, the less intense it is. So get to a point that, you know, is not causing any pain, but perhaps, you know, is in your depth. And then you take your hands out in front. I use my full palms. Again, toes are turned out. You can pull your outer left heel towards your hip, and that's going to activate your biceps femoris. Okay, that biceps femoris, your hamstrings, will close the knee joint, making it a little more accessible. And then we bow. Left knee towards the ground. You know, where your foot is, it does matter, but for right now, just find the place that is easiest to get your left knee towards the ground with your shin more or less parallel to the ground, to the front of that. If there is no space you know, like there's no way to have the shin parallel to the front of the mat, that's because there's not enough available external rotation at the hip joint, you know, and even now I'm struggling a little bit, but I'm finding if I move my foot to the left or the right, I have a little more access, and I'm gonna move my hips back. But either way, it requires a great deal of external rotation in the left hip. And now we're a little more passive, okay? But if you wanna take this stretch a little bit deeper, you take the right forearm to the ground and twist, not, you know, forward so much that you lose the stretch. You actually want to push your hips back to increase the stretch. And then if that puts pressure on the inner knee or strain on the outer knee, take your hand, left hand, and push the skin of your thigh down and out to the left. Woo, that increases the stretch quite a bit because it's going to improve the external rotation of the hip joint. And that will stretch the piriformis. Piriformis muscle is an external rotator, but in this position, when you're deeply hip flexed, it's an internal rotator, which is why it stretches when you externally rotate. It's because we're in hip flexion. And piriformis syndrome, you know, that's a muscle a lot of people struggle with health-wise. Strengthening it and stretching it is what improves the health of it. You're gonna turn your toes out wide, bend the knees out wide, and let's sit down for a moment. You can use your hands to press your knees out, but then pull your outer heels towards each other, activating your outer hamstring muscles. Okay, then try to take the elevator down as low as you can, and think about bringing your fingertips to the ground here. Pull your outer heels toward each other and maybe even turn your shins out. One thing you could do is pulse a little like you're gonna jump off of your feet and get these muscles engaged while they're stretching. Maybe move a little side to side. Take your feet wide, turn your toes out, and come into Skandasana. We'll do it with the toes pointing up to the sky. This is a deep stretch for the inner right thigh. Of course, if you can't come down the way that I came down, it's likely it's because of your left hip. Okay, you can stay up here though. Quite nice. It's just about getting the right adductor stretch, so don't push it. It's not about the shape. It's about what's happening in your muscles. It's not about achieving the shape. It's about what you're doing, the stretch you get along the inner right thigh. So wherever you are is appropriate if you're getting that stretch. Lotus pose, the first step is to be able to get your knees as wide as possible. So what I do is I bring my feet into like a Baddha Konasana position. You know, the knees out to the side. So what you can do here is place the feet together and try to pull your knees back and out. You can even lift your hips up and move your pelvis forward a little bit. And you see what I'm doing. I'm starting to flex the feet and what we're doing here is just training the legs to go out to the sides more. And you can bow forward as long as it's not pressure on the low back. If there's pressure on the low back, then stay more upright like this so you keep a more extended spine, okay? If you feel pressure on the low back, extension of the spine, lift the heart, okay? If it's okay on the low back to go forward, you're trying to pull your knees out and back because this is going to help us with the action we need to get the foot into lotus pose, is to widen the legs, okay? So watch. If I bring one foot in here, if I wanted to get this foot into lotus over here, I would move this knee way out to the left. So you can hold the foot, and then I'm gonna clamp the leg, and some of you putting a sock behind your hamstrings might help, but I'm gonna pull, not with my hand, I'm pulling using my hamstring muscles, trying to close the knee, and then I'm gonna push with my hand the knee way out to the left, and then maybe I stack my foot on top of foot, or if I have enough height to this pulling of the knee to the side, I can cross by, watch how I turn my whole pelvis over to the right. That's the important thing. A lot of people are just, pulling their foot up like this. That's gonna put the pressure on the knee. So I keep the knee closed by going way out to the side, and then I move my pelvis, watch, lean to the right, turn the whole pelvis to the right. And then I come back and I'm in half lotus pose. Now, for many of you, I feel a little pressure in my left knee. So what I'm gonna do is I'm gonna try to close the knee joint by squeezing the imaginary socks, and then voila, it feels great. But I'm trying to turn my top of my foot down as I do that. So turn the shin out, or you can pick up your calf muscles and move the calf forward to turn the shin down. And then you can move your thigh outward. So you can move these in two different directions, okay? But I'm gonna try to close the knee joint using the hamstrings, specifically biceps femoris, pull the knee closed, and it feels great for half lotus.